Right, hey everyone, Mark Folmer here, TrackTik's Vice President Security Industry, here today with Ken Close. Ken, thanks for joining us today. Ken is the Chapter Chair for ASIS Toronto, Chapter number 193. His day job, because the first one's a volunteer role, is Manager of Security and Parking Services at Trillium Health Partners. Thanks again. So our focus today, we want to talk a little bit about security in the healthcare setting. And wanted to get your take. So talk to us a little bit about the nuances in and around kind of security in the healthcare environment.
Sure, and again, thanks for inviting me to be a part of this series that you have going on. Healthcare, I've always found, is kind of a very unique niche. A lot of security, important in regards to protecting assets and doing all those sorts of things. When you get into the healthcare industry, you're actually dealing with people at their worst, and you have to really try and support them, while they're receiving their healthcare needs.
Yeah,
another unique example I'll give is that, you trespass somebody from a mall, they never need to come back. If we trespass somebody from a hospital, it's unless they need to come back for their healthcare
service. They legitimately need to come back.
Correct, because you can't deny anybody their healthcare within the country. So I find that's a very unique niche, and one of the things I think that's helped create some great police officers in the law enforcement industry is security officers in healthcare, because they really get an understanding for mental health, which is really increasing in our community. It's a challenge for policing services, it's a challenge for healthcare. So I find that that's a very good asset for the individuals that come through the security team and then end up getting into law enforcement agencies locally.
Great. Yeah. So nice training ground for future police officers.
Correct.
Excellent. Yeah. Super. Talked about the nuances. Where do you see it going? I mean, talk to us a little bit about where you see security sort of helping the overall mission of the hospital. What kind of trends do you see popping up in healthcare security?
I think it's just really looking at the demographics, what's going on around your area. A really, really big challenge right now is capacity within healthcare. I know within Toronto, and I don't think we're unique across the country, is our physical buildings don't have the capacity to support our communities because they're growing so quickly. You end up with patients in hallways, and then you get complaints, so it's this whole trickle effect, and then patients aren't happy. I can't get my healthcare treatment quick enough. They complain, people get more aggressive, and then again, that impact and ripple effect basically, there's more need for security and for security to actually support that. One program that I know was implemented was a security ambassador role out of BC, and it basically looked at somebody going around with an iPad and trying to do customer service for people in the waiting room and being a communication tool between the waiting room and the clinical nurses in the ED to try and really alleviate a lot of that stress. So I think just a lot of that
kind of an outreach.
Correct, and really just getting people's feedback. We just saw a presentation at a session I was at where a doctor out of Ottawa actually created hospitals for the homeless, or a hospital, and it basically was created based off of the feedback from the homeless, and they feel more comfortable going there because some of them don't actually have OHIP cards or whatever they need, and they can't just be sent home with a prescription. So they basically really designed this based off of the needs for the homeless community, which I thought was incredibly innovative and supportive. So I think that's the biggest thing, is just getting the feedback from the people in the community, and how do we deliver that healthcare to them, and then in addition to that, how do we basically provide the security support to make sure that we're keeping the whole organization safe.
So, Ken, thanks very much.
Thank you.
Quick recap. Security in the healthcare environment, very specific, just like other environments can be different, but proactive seems to be better. Training ground for future police officers, and really working with the stakeholders in the hospital, kind of make sure that the facility stays secure. Thanks very much.
Thanks.